Let's Talk About Pain, a podcast from the Quebec Pain Research Network. In each episode, we discuss the latest advances in pain research with guests from across Quebec in the health and research communities. Enjoy your listening.
Hello, and welcome to this new episode of Parlons Douleur, or Let's Talk Pain, a podcast created in collaboration with the Association Québécoise de la Douleur Chronique. My name is Carlos Hevers Montoro. I'm a postdoctoral researcher at McGill University under the supervision of Professor Mathieu Roy. Today we're offering you a somewhat exceptional episode with the participation of two eminent figures in the field of pain in Canada. We will have the pleasure of first welcoming Fiona Campbell, who our audience will undoubtedly recognize as the former president of the Canadian Pain Society, and her discussion will be followed by an interview with Jean-François Leroux, who is currently in charge of the chronic pain policy team at Health Canada. So without much ado, let's get started with Fiona. Dr. Fiona Campbell is a pediatric anesthesiologist and a distinguished professor at the University of Toronto, and the medical director of the chronic pain program at the Hospital for Sick Children, where she also fulfills roles as co-director of the Sick Kids Pain Centre. She is also the co-chair of both the Ontario Chronic Pain Network and the Canadian Pain Task Force. Her research is dedicated to improving pain outcomes in hospitalized children. Committed to education, Dr. Campbell contributes as a senior editor to aboutkidshealth.ca-pain and spearheads an online pediatric pain curriculum, demonstrating her leadership in advancing pain education and management. She co-chaired the Pediatric Chronic Pain Advisory Network, contributing to a provincial strategy for pediatric chronic pain services, and served as the past president of the Canadian Pain Society. Now let's hear what Fiona had to say.
Well, thank you very much, Dr. Fiona Campbell, Fiona, for being here today with us. Before we get started with your work and discussing about the pain field, could you tell us a little bit more about yourself, your background, where you grew up, if you don't mind, and how did you get where you are today?
First of all, thank you very much for inviting me to participate in this, Carlos. It's really a pleasure. And you have to be careful for what you wish, asking me a little bit about what I've done since through my life, because it's been quite a long life so far. But so if I take too long, you can interrupt me. I'm a Londoner by birth. I moved to Canada with my family when I was 11. I went to high school in Hamilton, where I did okay, although I was more interested in sports, to be honest. I played on all the sports teams for school, and this has always been a big part of my life. I then went on. I took a gap year and I worked on a boat in the Virgin Islands, teaching people how to windsurf, sail, and scuba dive.
Whoa.
Yeah, and then I came back and did a BSc at Mac in psychology, which I loved, and actually wanted to be a child psychiatrist. I was fortunate to get into medical school, despite my grades not being what the kids seem to require for that today. And then after that, I took another year off and worked in a daycare center for underprivileged children in London, and then I came back and went to medical school. And after that, and a rotating internship and a couple of years working in the emergency department at a Toronto teaching hospital, I moved back to London. I'd met my partner on a skiing holiday. He was a Londoner, and by serendipity, I started training as an anesthesiologist. I loved pediatric anesthesia. I did a fellowship in Toronto. I returned to the UK, developed an interest in pain, and my first consultant job was in adult pain management. People in the pain field often have a personal story getting them there. Mine was that my mum was in a catastrophic car accident, which left her with a spinal cord injury and relentless neuropathic pain. So that's how I kind of got into the pain field. The opportunity then presented itself to move back to Toronto and take a position as a pediatric anesthesiologist at Sick Kids, where I am currently the director of the largest pediatric chronic pain program in Canada. I still practice clinically at Sick decades in both anaesthesia in the operating room and also my chronic pain practice. Beyond my clinical work, I've always dabbled in research, education, knowledge mobilization, and pain policy locally. Then about 10 years ago, by serendipity, I began my foray into provincial policy. So I was invited to be the inaugural co-chair of the Ontario Chronic Pain Network in partnership with the Ontario Ministry of Health. And as a network, we were pretty successful in getting proper ministerial funding for tertiary academic pain clinics in both the adult and pediatric sector. So this early policy success and the leadership role, I suspect, laid the groundwork for my interests in other areas over the last 10 years, which I'm sure you're going to ask me about. So I will hand that back to you.
Wow, Fiona, this has been quite a ride so far, and you still have so much to go. I would like to ask you, why your interest in the pediatric population? Where does that come from? Could you tell us a little bit about that?
Yeah, that's an interesting question. Thank you. I am a mother. I have 5 children. We wanted 4, but we had twins on the 4th, and I did always have so much fun with them. And then, of course, I worked in this day nursery for equity-seeking children of disadvantaged families in London before I even went to medical school. And I think that kind of consolidated my interest in this. And so, there's kind of intersections between, pain and medicine and mental health and children. And you don't know really exactly what contributes to your final pathway, but I suspect it's a little bit of all of that.
Yeah, fascinating. Also, 5 kids. I think that is maybe your biggest accomplishment. Can we say that?
Well, it's certainly the hardest work I've done.
Talking about that, is there something you would like to highlight, something that you feel needs to be highlighted or you feel proud of regarding your career achievements? Let's keep aside for a second your family achievement.
Really, I have loved everything about my career. I've loved being a practicing clinician, but I think it's been some of these leadership opportunities that I've been afforded that have been very gratifying, partly because they've been unexpected in a way. So my first kind of foray into leadership at more of a systems level was when I became the co-chair of the Ontario Chronic Pain Network in partnership with the Ontario Ministry of Health. And then I sort of got a taste of how you could influence the bigger picture. I think there we were very successful getting funding into tertiary academic pain clinics for both children and youth. And then when opportunities came up to serve on the Canadian Pain Society, I jumped at those. And then that led to working as co-chair of the Canadian, being appointed by the Federal Minister of Health as co-chair of the Canadian Pain Task Force. So I think it was those unintended things that have been quite particularly gratifying. And I think partly because they were unexpected.
This is exactly where I wanted to go. Leadership. I wanted to talk to you about your chapter at the Canadian Pain Society. Maybe you could talk a little bit to our audience about how was your experience as the president of the CPS and also the years you served on the board. And also, why is this organization important for people living with pain, not just for researchers and clinicians?
Yes, the Canadian Pain Society has been around for many years. As you've mentioned, it's a national chapter of the global organization with the kind of umbrella organization for pain. And I felt that to get involved with the CPS gave me a position potentially of influence and perhaps some impetus for change. I really loved my time on the CPS board, first as treasurer and latterly in president role. So you begin as president-elect 2 years and then 2 years as president and then 2 years past president. So I was on the board for about 7 years in all. I think I mentioned I first sat on the board in my role as treasurer, which my husband always thought was absolutely hysterical because I really liked spending money. Anyway, in addition to meeting the fundamental responsibilities of a board such as the Canadian Pain Society and the organization at large, I realized there was capacity and appetite to broaden its scope. And in particular, I knew that we did a fantastic job of supporting research, having an annual scientific meeting, but I really felt there was a gap in engaging people with lived or living experience of pain. And that work had started by my predecessors, but I really wanted to champion that. So operationally, I expanded the leadership team so that people chairing committees and special interest groups felt more involved. I established regular monthly meetings with the board and leadership team, and I strongly pushed for more inclusive engagement of people living with pain. I created the communications committee because if you're not scaling your messages, you're missing an opportunity to be relevant. And I know that you sit on the communications committee, so thanks for serving in that role. I drove the implementation of what I believe is a pretty successful mentorship program, and I hope your listeners will sign up for this as either mentors or mentees. I've co-created an art award competition in collaboration with my QPRN colleague, a friend and mentee, Zoha Delda, and so it's just has been an opportunity to expand in different directions that I felt were exciting and I also felt were needed, with the added benefit of potentially moving a little bit into advocacy. It was always more research, knowledge, mobilization, and education, but I felt we had a voice on the national stage to really help drive the pain agenda forward in different ways.
I think you mentioned something very important, which is that we do need to communicate and transfer the knowledge much better. So I think your role in that sense was absolutely quintessential, and I really am appreciative of being able to have worked with you and now doing some of the work that you started, for example, at the communications committee. I would like to ask you something, because you've mentioned before that as a president, you were invited also to co-chair the Canadian Pain Task Force. Who were your other partners in this endeavor? Can you tell us a little more about this?
Yes. I mean, I should mention that the task force was created as a result of a very impactful roundtable with the Federal Minister of Health, who met with a group of about 20 people for 3 hours just prior to Toronto Opioid Summit. The participants at that roundtable included leadership from CIHR, the Public Health Agency of Canada, including Theresa Tam, who then became very famous during COVID. Very importantly, people with lived experience of pain, health professionals from across disciplines, and researchers. I was there as a CPS president. So I really felt that we were at a tipping point, and was so excited when the next day that the minister announced the creation of the task force. This was a long answer to your question about who else was involved in the task force. So, the task force was established to provide advice and information to guide government decision makers towards an improved approach for the prevention and management of chronic pain in Canada. So we really needed to have representation of people who have a vested interest in pain. So the task force itself was only 8 people, and we wore multiple hats. So we had people who worked across the lifespan. We had 2 people personally impacted by pain. We had an Indigenous person. We had some gender diversity. We had researchers, educators, and health professionals with expertise across many disciplines in the pain field, and pan-Canadian. So as you can see, this really required people to wear multiple hats. In order to extend and broaden the expertise, we had an external advisory panel to provide additional subject matter guidance, and this was absolutely essential to our mandate.
This is very important work indeed. Could you deliver a simple message, for example, for people with lived experience and for clinicians who haven't been that involved? What does this work represent for them?
Okay. Well, I think, first of all, everyone must understand that 1 in 5 Canadians lives with chronic pain, and it's deeply impactful, often significantly disabling. It's poorly understood, undertreated, and costs the Canadian economy $40 billion a year. So this is a wicked problem and is not going to have a linear solution. And so there's actually places for all kinds of people from differing backgrounds to get involved in delivery of some of the aspirations contained within the action plan. As you know, the National Action Plan for Pain in Canada was a third of 3 task force reports that was delivered. And during our mandate, the Federal Minister of Health empowered the mandate by asking us to actually provide recommendations to government on what would be needed to validate people living with pain and how to prevent and treat pain properly. And so these 150 recommendations, and by the way, when we told the Federal Minister of Health that there were 150 recommendations, she about fell off her chair. But these 150 recommendations fall into 6 buckets or 6 goals, if you like. And they are that we need leadership in Canada to deliver on this. We need to improve access to care. We need proper training for people in the health field, but also for primary care. And we need public awareness. So that's sort of awareness and education. We need to improve research and its infrastructure needs to be properly funded. We need to monitor for the prevalence and impact of pain across Canada so we understand where it is in Canada and how it affects people living here. And then this all has to be taken with an equity lens. So when you consider those 6 goals, they're very kind of high-reaching, and you can see a place for people, no matter your background, to help deliver on some of these recommendations. So we're not all going to be leaders in a chronic pain policy team at Health Canada, although that was one of the recommendations, and we do have a policy team at Health Canada. But if you're a person living with pain, then you can dig into the action plan and maybe see some organizations that you can join and consider contributing to. If you're a health professional and you see that we need a new standard for pain management for adults in Canada, maybe you can get involved in creating that. If you're involved in research and you want to inform the research agenda, look into the recommendations and the priorities and use the action plan, leverage the action plan to support your particular cause. So there's so much to be done that anyone with a vested interest of pain can dig into that report and see potential opportunities to help drive it forward.
Yeah, it sounds like a very comprehensive and a very ambitious plan, but also highly needed, right? It's about time. Since we're talking about this, some of our listeners may also be interested in knowing how they could get involved and pursue a path towards policy, or maybe improve the way that things are done at the systems level, or advocate for pain. What can you tell these people? Which advice could you provide them with?
Thanks for this question. I've quite not infrequently been asked this question by people who are interested in improving the systems approach to how we assess, prevent, and treat pain. So, I think first and foremost, you need passion, some experience, and really an authentic interest in improving the way that things are done. I expect there are opportunities for formal training in health policy, which I did not avail myself of, and I can't really speak to or recommend anything in particular. But I think for anything like this, it's important to start low and go slow. Find influencers and leaders who may share your interest and provide some mentorship. Get involved and see what's happening in your local, regional, and national jurisdictions. Potentially talk to members of parliament where you see gaps and help create a movement to sort of drive the change. So I don't have anything sort of super specific in that regard, but it's, the ducks need to align. But by reaching out and having those conversations, I believe anyone can do this. This was not in my higher level plan, but I did seek out opportunities as they arose.
No, thank you for this advice. This is very important. We need people that get involved and at every level. So we're almost getting done here. I don't want to take a lot more of your busy schedule, but could you tell us a little more about future directions for you?
As co-director of the Pain Center at Sick Kids, I also sit as a hub lead for the National Knowledge Mobilization Network Solutions for Kids in Pain. And we're always tackling or exploiting new opportunities. And having created the first pediatric pain management standard in the world, we are now looking at ways to support its implementation. So I'm hoping to be involved in that work. We have opioids in youth project. So I've been directly involved in creating 2 freely available online modules to improve safe and effective opioid use in pediatrics, as well as co-creating educational material for not only kids and caregivers, but also for health practitioners. So those are a few specific, slightly more local and national things that I've been involved with. But my most significant new endeavor on the professional front is as a founding board member of a brand new nonprofit organization called Pain Ontario, which we hope is poised to be the central point of connection for people with a vested interest in pain in Ontario, including, importantly, people with lived experience who are on the board. They're going to be involved in driving this, but also includes the public at large and health professionals. And we're actually in the midst of engagement sessions to determine our mission, vision, values, and frankly, our actions for the future. It's very interesting in the Canadian landscape how different provinces have different strengths in their kind of provincial pain spaces. So I've already mentioned that Ontario's done quite well in getting funding from the Ministry of Health, but we don't have anything like what Pain BC has as a grassroots level for support for people living with pain. We know that Alberta has a strategy. There's an organization called Sask Pain. We know that Quebec has its own strategy and also has a QPRN network, but Ontario has not had a coordinated organization at a community level. So this Pain Ontario, I think, is going to probably take me into retirement. That's the latest thing that I'm doing. Yes, I will retire in the next little while. There's no doubt. But while, I have really, and I am still having a wonderful work life, it brings me enormous joy. And this will continue on into retirement. I still have some other work stuff to do, some of the local sick kids projects as well, nationally to implement recommendations from the action plan, including the pediatric pain management standard. I have a few upcoming speaking engagements, including at the QPRN annual retreat, and I will continue with providing mentorship. It's something I really do enjoy.
Yes, we're delighted to have you at the next QPRN annual retreat as one of the main speakers. We're very happy to have you.
Thank you for that invitation. I'm really excited to come to the QPRN meeting. Thank you.
Fiona, I think this wraps it up for me today. Before we part, is there anything else that you wish to tell the pain community and our listeners? Any message you wish to share before we conclude this conversation?
It's such an important field. Pain prevention, we've got to prevent it from becoming chronic, and we have to do a better job of treating people who live with pain. And this is predicated on research, education, leadership, surveillance, and ensuring we take an equitable lens, because we know that pain disproportionately affects equity-seeking populations. But in order to do these things well, you have to have work-life balance. You need to exercise, sleep well, have a good diet, and really seek out opportunities that bring you joy in things that you do. That's just life speak, but thank you for that opportunity to add in that final 2 cents. Thanks, Carlos.
Thank you, Fiona. I really think you embody what you just said, and you are truly an example and a great leader to follow. It's been an honor to have you here, Fiona. Have a great day, and we'll see you soon in Mont Saint-Anne.
Thank you. Thanks, Carlos.
Well, after this inspiring conversation, we followed up by interviewing Jean-François Leroux. Jean-François, or JF as he is frequently called, leads the chronic pain policy team at Health Canada. In this capacity, he oversees the coordination of the federal government's response to the recommendations of the Canadian Pain Task Force. Before joining this team in October 2021, Jean-François had several positions in the policy field within the federal government, notably at the Department of Finance Canada. Health Canada, and the Canadian Institutes of Health Research, or CIHR. JF took us through the last 7 years of his professional career, which made of him one of the most important figures shaping the direction of chronic pain policy in Canada.
Merci, Carlos. Donc, moi, c'est Jean-François Leroux. Je suis le gestionnaire de l'équipe des politiques sur la douleur chronique au sein de Santé Canada. En 2017, j'ai eu l'occasion de me joindre à Santé Canada afin de travailler sur la réponse fédérale à la crise des surdoses. C'est dans ce contexte que j'ai eu l'occasion de me familiariser avec l'enjeu de la douleur chronique.
In 2017, a new chapter began for Jean-François when he joined Health Canada, primarily to tackle the federal response to the overdose crisis. This role unexpectedly steered him towards the complex world of chronic pain management, sparking a keen interest in understanding how this crisis affected those living with chronic pain. Through attending numerous symposiums and engaging in discussions with healthcare providers, individuals experiencing chronic pain, and researchers, JF deepened his insights into the multifaceted issues surrounding chronic pain and those living with it.
Toutes ces rencontres ont vraiment culminé à l'automne 2018 à une table ronde qui a été organisée par la ministre fédérale de la Santé à l'époque, l'honorable Ginette Petitpas-Taylor, avec des intervenants de la douleur, notamment des personnes qui vivent avec la douleur chronique.
Our guests then delved into a pivotal moment in 2018 when a series of meetings culminated in a significant roundtable discussion. Organized by the federal health minister, this roundtable brought together a wide array of stakeholders in the chronic pain community for a comprehensive 2-hour discussion. The focus was on the impacts of chronic pain in Canada and exploring actionable steps to mitigate these challenges. The diverse viewpoints, especially those from chronic pain sufferers themselves, were instrumental in leading the federal government response to establish a dedicated task force on chronic pain.
Et puis c'est lors de la conclusion de ce symposium que la ministre a annoncé l'intention du gouvernement fédéral de mettre en place un groupe de travail sur la douleur chronique. Particulièrement lors de cette table ronde en 2018, on avait vraiment une perspective extrêmement variée. C'était pas seulement des chercheurs ou des praticiens spécialisés, mais la voix des personnes qui vivaient avec la douleur chronique était vraiment bien reflétée à l'intérieur de ces discussions-là.
Jean-François paints a picture of the task force journey, which spanned over 2 years and was marked by diligent efforts and collaboration. Officially launched in March 2019, the Canadian Chronic Pain Task Force had a clear 3-year mandate. This journey was divided into 3 strategic phases: a thorough review of literature and scientific evidence, national consultations to gather a broad spectrum of best practices and perspectives, and finally, the formulation of a final report brimming with recommendations. The ultimate goal was certainly to ensure that people with chronic pain receive the recognition and support they deserve, to enhance the understanding, the prevention, and the treatment of pain across Canada, but finally, to proactively address the evolving needs of those living with chronic pain.
Lors de sa création en mars 2019, le groupe de travail s'est vu confier un mandat de 3 ans qui était essentiellement divisé sous 3 phases. Donc, la première phase était vraiment de faire un compte-rendu de la littérature et des preuves scientifiques afin de mieux cerner les impacts de la douleur chronique au Canada. Lors de la deuxième phase, le groupe de travail a mené des consultations à l'échelle nationale afin de déterminer les pratiques exemplaires, les points de vue améliorés et les éléments d'une approche pan-canadienne visant à mieux gérer et prévenir la douleur chronique. Les résultats de ces 2 phases-là combinées se sont par la suite traduits en recommandations formulées à l'intérieur de son rapport final, le plan d'action canadien sur la douleur. C'est vraiment le résultat final, si vous voulez, de l'objectif principal de la création du groupe de travail qui avait été annoncé en 2018 lors du symposium.
Reflecting on the strides made since the action plan's rollout, JF highlights the enhanced coordination of efforts both nationwide and within the federal government's corridors. He points to the establishment of Pain Canada in April 2022 as a significant milestone, creating a national network dedicated to the prevention and treatment of pain. Yet, he doesn't shy away from acknowledging the hurdles in bringing the action plan's ambiguous recommendations to fruition. He stressed the importance of showcasing the tangible impacts of these advancements on healthcare providers and the broader health landscape, but most importantly, on those suffering from chronic pain.
Le plan d'action s'oriente à travers 6 objectifs ou thèmes bien précis, notamment une meilleure coordination des efforts de prévention et de gestion de la douleur au niveau national, un accès équitable à un continuum de services et soutien pour la gestion de la douleur. Nous avons vu en avril 2022 la création de Douleur Canada. Douleur Canada, c'est une initiative, un réseau, si vous voulez, national, qui regroupe 14 partenaires d'un océan à l'autre, qui, afin de mobiliser les ressources et les efforts afin de mieux prévenir et traiter la douleur au Canada. Il y a une conférence qui s'appelle la conférence Rassembler les morceaux du puzzle, qui a lieu maintenant annuellement lors de la Semaine nationale de la sensibilisation, qui est une conférence qui est menée par et pour les personnes qui sont aux prises avec la douleur, afin de discuter des différents défis, mais également de stratégies pour mieux soutenir les personnes qui vivent avec la douleur chronique. Ces investissements de plus de 12 millions de dollars ont notamment permis de mener des projets pilotes pour des approches novatrices de la gestion de la douleur, des projets afin de soutenir les fournisseurs de soins de santé et également soutenir des projets pour la mise en œuvre de programmes de mentorat et d'échange de connaissances, par exemple.
As our conversation draws near the end, Jean-François re-emphasizes the critical role of incorporating the perspectives of those living with pain into policy and program development. He invites anyone passionate enough about advancing chronic pain management to engage with entities like Pain Canada or the Quebec Pain Research Network. Finally, with a note of gratitude, he acknowledges the contributions of all those involved in these organizations and in the task force efforts throughout the last years.
On peut prendre par exemple la création du portail Surmonter sa douleur qui a été financé à l'aide notamment d'investissements à travers ce programme, qui fournit un accès à des ressources gratuites dans un espace centralisé comprenant des articles, des vidéos, des balados, des cours, des ateliers et du soutien par les pairs. On doit continuer de maintenir cette collaboration, la coordination des efforts. Je crois que c'est très, très, très important afin de pouvoir continuer de faire des progrès sur cet enjeu.
Our conversation closes with Jean-François expressing his appreciation for the chance to share these insights on the podcast, but in fact, it's rather the opposite. It is us who extend our heartfelt gratitude to both Jean-François and Fiona for participating in this podcast. I truly had a wonderful time, and I trust that you, our listeners, share my enthusiasm. Thank you all very much for tuning in to these episodes of Parlons Douleur, and hasta la vista. See you soon. Until then, take care.
Thank you for listening to Let's Talk About Pain. Don't hesitate to subscribe so you don't miss an episode and to share the podcast with your friends. For more information, visit our website at qprn.ca or our YouTube channel by searching Quebec Pain Research Network. See you next time.